Okay, so would you like to introduce yourself?
Yes, I'm Sister Lorianne.
Welcome.
Thank
Um,
you.
how long have you been coming to this clinic?
Actually, I began coming to this clinic in 1991, actually about 20 years ago this month. And it started with, I went to a football game. This is my recollection. I got a little damp, and during the night I got up to walk across the hall to the bathroom, and I really could not walk. I was just in pain, and I couldn't figure out what the problem was. I thought, I never had that before, so what was it? So, and as I talked to somebody familiar with this clinic, I said, I'm not really sure what to do. She said, well, I could recommend, and then she recommended this clinic. And so I painfully made my way through the weekend. I couldn't walk, I couldn't lift anything, going up and down steps, everything was a real effort just to maintain or pretend I could keep going. So by Monday morning, when I called the clinic and got my appointment, I was relieved to be able to look forward to getting some relief. And the symptoms, I wasn't certain about what was going on in my body. So I thought I was very happy to come here and get a total diagnosis and detailed and very informative for myself. Explanations were well done, and everything was with my approval, my understanding. So at that time, I came several times in a row, and I remember getting help from everybody around me. I was and still am a teacher, and so I couldn't carry my books to school, could do very few things, but I could teach. So week by week, I could see the difference in the recovery and in the movement of the body, and whatever ways I was being treated, there was everything was working right, and I call it getting my body back. So I was delighted, and I was extremely grateful for the person that recommended me for this clinic.
Wonderful. At that time, you were seeing Dr. Lala,
Yes, I was.
and he started out by, you said, a very thorough exam and x-rays,
Exactly right, yes.
and then you were having adjustive care.
Yes,
And then come around 95, you started to see me for muscle work.
right,
And finally, at about 2001, I was licensed in chiropractic,
yes,
and you started to see me for your care.
right.
And how did that go?
That I felt was a very good transition, because in the meantime, somewhere in those years, around 95, 94, late 94, I had a fall, which I had cellulitis, and some people get it once in their lifetime. I seem to get it several times in the late 90s, and I needed something to help me through that time. And what I noticed is if I would get run down or extremely tired or not keeping up on my exercise, so I needed something more for the preventative, for the maintenance. And when you saw me, that's when you again did a detailed explanation, and I understood what was going on in my body, or what did I need to do, what did I need to change, or what was I doing right, or what did I need to change. And so then again I had the maintenance, and then I felt the preventive care up front, so that when I would get, I call it the teacher thing, get to a vacation and say, oh, please don't let me get sick. Well, I didn't have to worry in a sense, because when I came on a regular basis, that once a month I felt I maintained and was able to explain what was going on in my body, what was good, maybe what was a little weak, and take care of it to be proactive rather than after the fact. So that was really a big turnaround for myself.
And for you, once a month seems to be key. What happened when treatments went beyond once a month? What would happen?
If I waited too long and thought, well, I could get through, I'm doing just fine, then I would get sick. I at times ended up in the hospital because I would say the circulatory and the immune system, all of that was built up when you worked with me. And the circulation, I know for a fact, in regard to the cellulitis, it keeps the circulation going in my body. So, and also the immune system, that no matter what's going on, I feel like when I'm treated, I know that I'm ahead of the game rather than limping along and getting too run down and too weak. So I felt that was a big change, being ahead of it rather than waiting too long.
What was the general treatment for cellulitis at that time?
For cellulitis, I received muscle work, and then you would always ask me questions, find out where I was at, and then give me suggestions. You would also give me handouts as to what was good for me. And I know to this day some of those exercises I do regularly, and I think it really does make a difference because I just fit them into the routine of my day. So usually I like to do them right away in the morning, and so that's what made a big difference with the cellulitis and the circulation, getting the circulation going in the body.
So what would happen if things went too long and you got cellulitis? How did your doctors handle the cellulitis at that point? What was the thing that you had to do then?
Usually if I got cellulitis, I would feel my leg swelling and my leg getting red, and then I would go, oh, and I would just get chills, which was of course the infection. And then usually by that time I waited too long, so even medication, it wouldn't probably be able to stop it. I end up going to the hospital and getting intravenous, which did in fact help it, but it took maybe 2 to 3 days. And then the doctor would definitely say to me, go to your chiropractor, continue those treatments, because of what he saw, how those treatments were helping me.
Wonderful, wonderful. And now, fast forward a little bit longer, you had a fall again just a couple of years ago.
Right.
On some stairs.
Right. I was going from the lower level of our school to the upper level. And the steps, it was a new building, and the steps have a nice rubber ridge, and I caught my toe on that and tripped up the steps. And to me, it was like, oh, I just fell, but no big deal. And it was a big deal because I didn't break any bones, but I did injure a lot of muscles throughout my body. And it happened close to the noon hour time. And of course I kept teaching and kept going to school every day, but I really was pushing it because every day I would get up and I would feel the pain throughout my whole body. And not only during the day, during my teaching day, but also during the night. Every time I turned over in bed, I could not find a place or a way to lay and be comfortable or at ease or to really rest. So I know for a period of weeks I came regularly and had the muscle work, and also I had the acupuncture, and I had especially the shoulder was very limited, and it was my right shoulder because writing on the board was extremely painful. And I would be like lifting my arm up and holding it up and trying to write, and the students were, oh, teacher, are you okay? And so little by little I could tell I was really improving as I was able to pick up that dry erase marker and write on the board with ease. And week by week, I saw the changes. And then a few months later, I saw an extreme change, and it made a huge difference. And I, again, continued to do those exercises like walking up the wall or whatever it took. I just said, okay, if I do this, I will get my life back. And that's really what happened.
Wonderful. What would you tell someone who's considering coming to this clinic?
I would tell them, by all means, do it. I remember when I first came for a chiropractic treatment, I had never had any experience with it, but come to find out later that in my family, my oldest sister goes to the chiropractor every month. And I said, I had no idea. And I thought, oh, and she said, oh yes, I wouldn't think of not doing it. So my recommendation would be, it's the best thing you can do for yourself.
Wonderful. Thank you. And do we have your permission to share this information with doctors, students, patients, and the general public everywhere?
Yes, you do.
Do we have any restrictions on sharing this tape?
No restrictions.
Thank you very much.
You're welcome.